Hey YouTubers, I didn't even see you there. Doc Wilderness here, wearing this white lab coat, so I'm a doctor. No, not really. Not even close. I know different colors of Band-Aids though, so, that kind of qualifies me a little bit. But we're going to go ahead and take this lab coat off, and we're going to put on this Black Rifle Coffee Company hat. Go check them out. Black Rifle Coffee. They have a subscription a month club. Best coffee out there. Always fresh. But anyway, we're here today to talk about my IFAK kit for everyday world situations, mostly for hunting, camping, hiking, trekking, whatever the case is. So this is the pouch that I carry. It's a Y-Nex tactical pouch. It's a pretty big pouch. Right now it's empty. I have everything laid out here. The only things I do have in here, and I will come close here, are my pneumothorax tension syringes, so my chest darts. These get thrown right into the chest for a patient with breathing problems. But anyway, I'm not getting into any diagnosis. But anything you see here, disclaimer, anything you see here today, if you don't know how to use it, please do not have anything in your pack that you do not know how to use, because it's going to be bad. You can actually make somebody worse by using something you don't want to use than making them better in a situation where they really need medical care. So, anyway, I have 1 ml with 25 gauge syringes, and I have 20 ml syringe for irrigation or wound cleaning, and then I have other 6 and 3 ml syringes for irrigation and wound cleaning. It's a pretty nice pack. I got 2 sides. It holds a lot. You can see it's got, whatever. It's a friggin' pack. Everybody knows. Everybody's got a pack. So that's that. So what's in my pack? First off, my injectable medications. Okay. If you don't know how to use any of this, don't touch it. Don't even think about it. These are in here because I know how to use them, okay? I have life-saving medication in here, in vials, in ampoules. I have needles and syringes in here. I know how to use this. If you do not know how to use medications, don't touch them. Please, do not touch them. There's courses out there. Take lessons, learn things. Knowledge is key. I'm always learning new things, and I love learning, and it's the best. I have vials for oral medication, Advils, Aleve, Pepsids, Tylenol, anti-diarrheal, everything. It all fits right in here in little bags. It's enough for 3 people for a good week and a half. It's great, okay? I got antiseptic wipes. I got alcohol wipes. I have this little bag made up with triple antibiotics. It's got antacids in it. It's got non-aspirins, aspirins. It has surgical glue. It's got a couple of 22 gauge needles and a 25. I got some steri strips just in case I don't feel like suturing. I got this trauma gauze. It's got a hemostatic agent in it, and let me bring that up close. These are great to have. Wound dressing, just lubrication. That's all it is. Wound dressing, lubrication. All it does is, you don't want to, infect the area that you're trying to work on. So, I got combine pads and trauma pads. These are great for pressure, for open wounds, active bleeders, gunshot wounds, anything from getting a branch stuck in your arm, or if you're cutting a piece of cordage and you fillet half of your arm off, we're gonna pack you with these, and then we're gonna throw some bandage material around you. So same thing, ABD bandages, same thing. They got a colloidal agent in them that they're very thick and they absorb. So you pack heavy bleeders with these. Also with those, for our more lighter bleeders, I got a bunch of 4x4 gauze. Again, 4x4 gauze. Alright? Even for the little guys, your girlfriend punches you in the eye and you got a little nick, it's kind of bleeding there. So we got 2x2 gauzes. They're great. A 2x2 for little wounds out there in the field. If you accidentally rub against a branch, or you fall and hit a rock and you got a little cut on your elbow, it's good for those. I'm going to jump here to bandages. So these are Coflex bandages. It's about 15, 20 feet. Altogether, it's about 30 feet. Great for pressure wrapping. They're very stretchy. They're very very easy to work with. Very easy to maneuverable. This is how they come. They come in rolls, okay? So I compress them so I can fit them into my IFAK. The more room, the better. And I got duct tape here. I also have a good amount of yardage of duct tape. Duct tape can also act as a bandage wrap. More duct tape, that's it. And then I have porous tape, 1-inch porous tape, and a 1/2-inch porous tape. Okay. I have 3x3 gauze. So all the way from 4x4s to 2x2s I have gauze I carry. I always carry a lot of gauze because gauze can act as band-aids. They can act as sealant to stop bleeding. They can, clean up, a dirty pot. They can, paper towels. They can do anything. I have a bunch of Telfa pads, wound dressing. They have they're made out of a great material that you can put any kind of ointment, triple antibiotic, any kind of mupirocin, SSD ointment, and put it right on the wound and wrap it. So these are great for that. I have a mask just in case, just following protocol. I don't know if we run into, if we're in Mozambique and we run into, Ebola or Zika or any kind of this flocka flavor, whatever is out there nowadays. So I got a face mask. Oh man. So CPR breathing barrier. This is for sanitary purposes when you are giving breaths to a patient that is unconscious and stop breathing, so you don't have mouth to mouth. If I can grab it to use it, I will. Other than that, I don't really care. I just want to save the patient's life, so I'm not going to, spend 15 seconds looking for my little barrier to put over, our lips so we're not touching, come on. This is a real-world situation, so we're not doing that. Never go anywhere without triangular bandages. Triangular bandages have multi-purposes. You can dress wounds with them. You can use them as slings. They come with the safety pins. These are great. Never go anywhere with at least 2 triangle bandages. I got this bleed stop stuff. It was the cheap stuff. I haven't used it yet. I don't know what it's like. It's like as you see it on TV type deal. So they're granules. They're just aseptic granules. just the quick clot. That's all they are. It's the same thing. I haven't really used them, so I don't know if they're good. They were very cheap, so if they're good, I'm gonna keep using them. If not, I'll go back to quick clot. Not a problem. Always have your shears. You know, I have a pair of these shears and trauma shears. I got my gloves. If I can go for my gloves, I'm going to. Just because I don't want any kind of anything on me that can be potentially infectious to me. So I will grab gloves if I have to. If I don't have time to, I'm more worried about the patient than the gloves. So the gloves are out of the question. But 99% of the time, I will grab my gloves first. All right. So I have my suture kit. So this has PDS, Vicryl, and Epsilon in it. So 2 absorbables and Epsilon. And it also has 2 size 10 scalpel blades. This way I can suture somebody up if they have a bleeder that's not stopping. And then I have my needle holders or Olsen Hagars, they call them. Addison Brown forceps right here and a scalpel. So I have full quality to save a life from a gunshot to a, oh my God, my pinky hurts. So, and you know, I actually do have Band-Aids. Most IFAKs, or I've never really seen an IFAK that had Band-Aids, but I got some Band-Aids I carry around just in case with a roll of Elasticon. So, hey, train. Always want to train. Repetition's key. Make sure you know how to use things in your medical kit. Make sure that everything Nalvasin. I have 2 bottles of Nalvasin. Nalvasin is chlorhexidine, antiseptic, antimicrobial. I can flush wounds out with this. I can clean things with this. I never go anywhere without these. And my chapstick, obviously, because I always have somebody whining, saying, "Oh my God, my lips are chapped." So I got the chapstick. Always be prepared for any world situation. And this is what I usually take on a hike or a long, like 2, 3, 5 day, maybe a week camp trip. So I got to get back to work. I shouldn't have been doing this video anyway because I am at my job right now. I'm not wearing these scrubs just for the hell of it. But for everybody out there, I want you to be safe. I want you to be prepared, and I want you to stay vigilant. So with that, I'm Doc Wilderness, and we'll see you later for part 2 for my other IFAK that I carry on me. So we'll see you later.